Hi everyone, my name is Jennifer. I'm making this video for those of us with infertility or trying to conceive and having difficulties. Um, Basically, I am reaching out because I know what it's like to go into the doctors and not know what to ask or not understand really what they're saying or what they're doing, but just going along with it because you think that they know best. Truth is, they don't always know best. They call it practicing medicine for a reason. So, a little bit about me. My husband and I have been trying to get pregnant for 5 years. It started with an accident, and I got pregnant by some rare miracle. Um, and I think I was about 10 or 11 weeks when we miscarried. I was young and not really the smartest back then. I didn't want to go to the doctors, honestly, because I was afraid of facing the truth of being pregnant, and I wasn't really ready. Um, but of course, once we lost the baby, we had gotten ready, and once you get ready, you don't really get unready for that. So we definitely started at a young age. We were both 20. But if I had known then what I know now, things would have been a lot different. I would have been able to handle the situation a lot better. I would have known what my risks were. And that's why I'm here. I want to reach out to those of you that need a hand. This is a really confusing, overwhelming journey that we have to travel, and it's not fair to have to do it alone, and it's not fair to have to do it without guidance and without somebody there to answer some of your questions, somebody that might know a little bit more than you. Um, and after 5 years of trying to get pregnant, I've ventured nearly every avenue that I personally can. And the things that I haven't ventured, I've researched. And I've also talked to many women who've gone through different things like in vitro. We haven't done that yet. It's a little too expensive, unfortunately. But we kind of need to be able to reach out to somebody like that. And so, again, that's why I'm here. I want to be able to answer your questions. I want you to reach out to me, ask me any question, nitty gritty. I don't care how much information you're spilling, the whole TMI thing. I've heard it all. You really cannot surprise me. Um, but I just want to confront those things. I want to sit down and make sure that everybody is getting taken care of because I did this alone and it was really scary. And I didn't have anybody to lean on. I didn't have anybody to tell me whether or not I was doing the right thing or if I was crazy or if the doctors were actually taking care of me right. And truth be told, they weren't. I had to see a total of 9 doctors before I actually got diagnosed with something. And when you go to a doctor and you tell them, I don't have a period, and they tell you it's normal, there's something wrong. I saw, like I said, 9 doctors total, and they were OBs. And for some reason, to them, not having a period at 20 years old was normal. My body was regulating itself, is what they said. And then they kept trying to push me on birth control. And it's like, did you not hear the part where I told you I'm trying to have a baby? So while I'm seeing these doctors and getting told that my period is normal, I ran into one in particular that I really wanted to share with you. It was a male OBGYN, and this was the first male OB I'd ever seen. I went in there and I sat down and, I told him what was going on, and he, without doing any tests, no ultrasounds, nothing, looked at me and he said, "You don't ovulate." That was hard to hear. And he was very cold and very stern about it. He didn't really seem to care whether or not I had any feelings towards the matter. When I told him that we were trying to get pregnant, he asked if I was married. We were not at the time. My husband and I hadn't been together for very long, but we were in a loving, trusting relationship, and yeah, we probably were a little bit too young to try and get pregnant, but being as that I knew I had something wrong with me, it wasn't really that far-fetched for us. It was okay. And we had come to an understanding that if for some reason our relationship didn't work out, that we would always make the best decision for the child, and that was what was important. But anyways, so he's asking me if we're married and everything. When I tell him no, he's like, "Well, we need to put you on birth control." And I'm like, again, we're trying to get pregnant. I'm not interested in birth control. And then he sat there and repeatedly told me what a period is. I'm like, I do know what a period is. I have had them in the past. I just don't currently. I haven't had one in probably about 6 months at the time. And, but he didn't care. He didn't want to give me answers. He didn't want to help me achieve my goal. He just wanted to put me on birth control. He kept saying that would regulate my periods, and that was the answer. Needless to say, I stormed out of there. I was pissed, for lack of a better word. I was so angry and so hurt, and I almost kind of inverted because it was at that point that I felt like nobody was going to help me. Um, so I gave up. I went home and we threw in the towel and we said, well, whatever happens, happens. And a little while went by, and all of a sudden, it was probably 3, 4 months went by, and I started getting really bad pain in my pelvic region. And I mean, really bad, like buckling over, crying, couldn't move, could hardly breathe, felt like I was going to throw up. So we went into the hospital. And they did an ultrasound and they found ovarian cysts, very large ones. And so they gave me pain meds, subsided it, whatever, sent me home, made me follow up. And I took a recommendation from the ER doctor on what OB to see in the area. And it was a new OB that I hadn't seen before. And I was hoping that they would give me something more. I went in, I saw the best OB I've ever seen in my life. And she diagnosed me with PCOS. I was happy, I was sad, I was scared, relieved that I finally knew what it was that I had, that I was facing, and a little bit confused because I didn't fit the typical PCOS view. I wasn't really that overweight. I mean, 10 pounds, but that's not enough to signify an insulin resistance issue, I wouldn't think. But she showed me my ovaries, and sure enough, there's all these little tiny follicles all over them. It looks like a string of pearls across the bottom. She checks my hormone levels. My testosterone is elevated. My insulin was slightly, on the high side. It was kind of just barely showing insulin resistance. So she said to get it under control with diet. And then she put me on Clomid. At the time, I had no idea what Clomid was. I thought it was going to be this miracle drug that was like, oh, here's a pill and you get pregnant. Because, again, at the time, I didn't really know anything. So I took this pill 5 days out of your cycle, and holy hell. Let's just say symptoms like you would not believe. I lactated, produced some breast milk. I don't really understand that one still. When I called my doctor, she said, it's fine as long as there's no blood in it. I'm like, okay, that doesn't seem fine, but I'll go with it. So yeah, every time I was around a baby, I would start producing breast milk. That was great. But aside from that, the more common symptoms, which mind you, I've never heard anybody else produce breast milk other than myself, so I think I'm maybe the 0.01% that's ever reacted like that to this medication. But so the other things are hot flashes. Those were pretty bad. I was really moody. I think I tore my husband's head off like 27 times a day at least. Poor guy. I don't know how he stuck around through it. And, that's just scratching the surface. But anyways, I was on that for about 4 months before I stopped seeing that OB and gave up. I moved on to a lot of different herbal treatments, which we'll get into all that later. But needless to say, I tried naturally with herbs and supplements, diet, exercise for a couple of years. I was tired of dealing with the side effects, and I really wanted to control it naturally, which I was able to achieve a natural cycle, like normal, right around 28 days-ish. I got positive ovulation tests, which was the first time in my life. So I thought for sure I was going to get pregnant. And as time went on, nothing happened. And it just kind of circled back around and around and around. And I kept doing it over and over again. No success, no relief. But this is when I really divulged myself into the research. I just kept digging, and at that point, I went and I got an HSG, which is where they check to see if your tubes are clear, which they were fine. We got my husband's sperm checked, and it came back with flying colors. So we knew that the problem relied in my ovaries. We knew that it was all me, and that's a hard thing to accept. I'm sure a lot of you women have to deal with that. It's like you almost feel defective. Like you're broken, like there's something wrong with you, and it's all your fault. But it's not. It took me a long time to accept that. I think that it was probably about 6 months ago that I finally let that sink in, that it's not my fault. This is not something I did. This is not something that I'm responsible for. I mean, I'm responsible for taking action of my own life, but I am not responsible for what my body is doing, for why it's not working right. I'm not defective. I'm perfectly capable of carrying a child. I just have to get there. And it's going to take a lot of work. I'm still working on it, lots of stuff. But we started seeing a reproductive endocrinologist or a fertility specialist, however you want to put it, and they put me on Clomid again. So thank God I didn't start lactating this time. And we started monitoring with ultrasounds. And these ultrasounds are vaginal. If you haven't had one, they're not really the most comforting, but you get used to it. I've probably had more doctors down there than I can count. But basically, so they take a look at your ovaries, they count how many follicles are on it, all that good stuff. Well, first month, I didn't really respond to Clomid. It just barely gave me an egg. My uterine lining was really thin. And the doctor kept saying, it's okay, you know, you build up a momentum. Your second month is always better. And I went in the second month and I had cysts. Go figure. So we dealt with the cysts. I got on birth control for a few months until they went away, which I didn't really consistently take because I'm stubborn and, you know. But anyway, so, sorry, I'm a little sick. But at that point, we ended up going back and doing another round, and this time I had done my own research. I found a clinical study on the National Library of Medicine. They basically publicize different clinical studies, medical journals, that kind of thing, so that people can find the information that they need to. So I found one that had been done a while back on researching Clomid in combination with an herb called black cohosh. Black cohosh is a phytoestrogen. So it's supposed to thicken your uterine lining. It also stimulates the luteinizing hormone and follicle stimulating hormones. So, and I'll explain more of that later. Any questions, again, just please shoot me a question. I'll explain anything in another web video. I'll get a lot more specific. I'm just trying to give you a rundown of what it is I've gone through. So anyway, so I combined black cohosh and Clomid against my doctor's regulations. He said not to do it. He said that it could interfere with it because Clomid reduces estrogen as to where black cohosh may increase it, to which I did more research. Black cohosh does not actually increase estrogen. It helps your body metabolize it better. So anyways, so I took this, and mind you, this was the best cycle I had ever had. I had 2 great, healthy eggs that were ready to release off my ovaries. My uterine lining was nice and thick. Everything was great. I mean, it looked like I was going to get pregnant for the first time ever. We did IUI. I was so ready. And before I started my period, I just started getting this wrenching pain in my right side. And I thought it was an appendicitis. I was freaking out. It started at 6 o'clock at night, and I just laid there and I tossed and I turned and I tossed and I turned, and I dealt with it because I've been in a lot of pain before, and I was like, well, we'll ride it out as long as I can. But 5 o'clock in the morning rolled around when my husband was getting up for work, and I had only slept maybe 30 minutes accumulative through the night, and the pain was so bad that I was now vomiting, and so he rushed me into the ER. They too thought that I had an appendicitis at first. They took me in for a CT scan, everything like that. Come to find out that it was cysts again. They were both about the size of a grapefruit, if you can picture that. And so it was pushing on my appendix. That's why it was causing that pain all the way over on my right side. It was like right above my right hip where your appendix would be. So I was in so much pain that it took them 6 doses of morphine and a dose of Dilaudid before I finally stopped screaming and puking. I was in the hospital for, I think it was 2 nights, but honestly, it's really foggy. I don't remember a whole lot. But, and I remember that when the doctor came in on the day I got discharged, he told me, he goes, it's probably endometriosis, is what he said. And then he said, well, it could be OHSS, which is ovarian hyperstimulation syndrome. And I was like, okay. And then he's like, but basically it's a hemorrhagic cyst. And I'm like, a hemorrhagic cyst, what is that? So I look it up. It's basically a blood-filled cyst. Oh, that's a little scary. But from what I was reading, that they're relatively normal. But the fact that he mentioned endometriosis is what really resonated with me. My mom has endometriosis. My aunt has endometriosis. It's pretty common in my family. My cousin also has it. But and little did I know it's actually genetic. So of course at that point I'm like, okay, I need to figure out if I have endometriosis too, because nobody has looked, and you can't diagnose that without surgery. So I went in for surgery. They looked. The doctor said that there was some inflammation, but no endometrial growth. So nothing that was black like endometriosis is. Um, so those records got transferred to my reproductive endocrinologist, and when I went in and I sat down with him, he actually said, in fact, I do have endometriosis. He said it's just a really mild stage, so it shows as inflammation rather than growths, which explains a lot. I get pain during sex, and I'm cramping pretty much all the time. So I have pain. I'm very accustomed to it. But anyway, so at that point, of course, I'm doing my own research. I'm trying to figure out what would be the best medication for us to use, because all we had ever tried at that point was Clomid. I had heard a lot about Femera and Letrozole. They're the same thing, but different names. And I really wanted to try them because I heard that some people with PCOS use them and have success. So I just kept digging, found more research, found out that basically my problem is estrogen dominance, which is a pretty common issue with anybody with endometriosis or with PCOS. Basically, we're just exposed to too many external estrogens these days, like soy and, BPA, those kind of things. Um, but, so in a nutshell, I pulled up some clinical trials. I showed him my RE. He agreed to try one of them. And so I am using currently Femera, also known as Letrozole, and Lupron trigger shots, which, mind you, are hell. They are terrible. Oh my gosh, like the worst thing I could ever experience in my life. But it worked. I'm not pregnant, but I know that my egg released. And that's the other thing. Sorry, I almost forgot. My RE also told me prior to my endometriosis exploratory surgery that I have a really rare condition called LUFS, which is LUFS. It stands for luteinized unruptured follicle syndrome. Basically what it means, in the rare instance that I do produce an egg, it doesn't release from my ovaries. So that's where those cysts kept coming into play with Clomid, because Clomid suppresses your LH, which is what helps the egg release. And I was doing HCG trigger shots, but it just wasn't working. Nothing was actually triggering it to release. So I got stuck in this endless loop, not really knowing that I wasn't getting anywhere for 4 years. Anyway, so then we got really close to doing in vitro, and we backed out last minute because of the expenses. It was just too much. And that was when I went in and brought all the clinical stuff to my RE, and we had talked about doing the Lupron and the Femera, and now I'm on that. So anyways, with all that being said, I just wanted you to kind of know my story and everything I've gone through, and I want you to know that any research that I do is based off of valid, like, actual proof. I'm not going onto forums and taking Blojo from Kokomo's advice or experience. I don't do that. It's not reliable. At all. Everybody's experiences is different, and just because one person ended up having it react that way doesn't mean that every person is. Kind of like me and the Clomid. I lactated. Not everybody lactates. That's not a normal thing. You're not going to find that on a forum. I didn't even find that on the side effects model. So explain that to me. But anyway, so I just want you to know that I am going to do my best for you. I want to return the favor of being able to educate you on your body. Be your advocate at the doctors. Be your own advocate. That is the hardest thing. You've got to know what questions to ask. You have to know what labs to request, because your doctor doesn't know you as well as you do. Your doctor is not going to cover all the bases. And if they do, hands down, you have the best doctor I've ever even heard of. And I've seen so many doctors by this point that it's ridiculous. So shoot me questions. Ask me anything. If you have digestive issues, it can be related. I had digestive issues for a long time before I found out I had PCOS. And then once I got my PCOS under control, my digestive issues went away. So it's just little things like that. Your whole body is a machine. It's kind of like a car, If one thing goes out in the car, it puts stress on the rest of the engine or the rest of the whole process. And eventually you end up wearing down other parts of the car just because one piece is broken. And that's kind of the way that we are, So everything is connected. Just remember that. I have a very holistic approach, even though I do recommend lots of medications sometimes depending on the situation, because sometimes holistic medicine isn't exactly the best or the most effective or the fastest. And a lot of us are impatient. I mean, this is a lengthy process, and natural medicine takes a lot of time. But the biggest thing is that I combine both, which is something that doctors don't recommend. I'll be honest with you. I mean, you can ask your doctor all day long if you can combine herbs, but they're on a general basis, not all of them. I won't speak for all doctors, but on a general basis, they don't recommend it because they are educated on pharmaceuticals. They are educated on that. They are not educated on herbs. So it's a difficult topic, If you go to a naturopath, sometimes you get somebody that's willing to do both, but it just really varies. So anyway, but that's all I'm going to share for today. I'm going to leave this open for questions. I really hope that I'm able to get some questions from you ladies or gentlemen. I'm more than happy to answer questions for men as well. I know a lot about how to increase, sperm count, morphology, that kind of thing. There's lots of natural things that you can do for it, and also a few pharmaceutical things without jumping straight to IUI or IVF. There are other options. So don't think you got to spend top dollar to get good treatment. That's the other thing. Doctors are in it for the money. This is their career. As much as a lot of them may want to help people in conjunction, ultimately, as an end result, they need that dollar. That's what they're doing. They're chasing that dollar. If they didn't get paid, do you think they'd still be doing it? Probably not. I know I wouldn't still be working if I didn't get paid. And I love my job. But anyway, so I hope I hear from you guys, and I hope that my experience resonated with you a little bit, and I hope that I can help. I really do. So thank you.